Cholesterol Demystified, 12 Essential Truths You Should Know. Cholesterol doesn't usually shout for your attention, but it can quietly raise your risk of heart attacks and strokes if left unchecked. That's why once you hit 40, it's a smart move to get it tested every 5 years. It's simple, fast, and could save your life down the line. But here's the catch: cholesterol can feel vague. Like that background app draining your battery without you noticing. And with all the misinformation online, eggs are bad, or sugar's the only villain. It's easy to get confused. Let's clear the fog with 12 things you really should know about cholesterol, from diet myths to meds, and everything in between. 1. What is cholesterol, really? Cholesterol is a fatty substance your body needs. It's used to build hormones and cell membranes. But too much of it? That's where the trouble begins. There are two main types. LDL, low-density lipoprotein, the bad kind. High levels clog your arteries. HDL, high-density lipoprotein, the good kind. It helps sweep LDL away. 2. High cholesterol equals silent risk. You could have high cholesterol and feel perfectly fine until it's too late. That's why proactive testing is so important. Over time, excess cholesterol can cause plaque buildup in your arteries, like limescale in a washing machine. Eventually, it blocks blood flow, leading to heart disease or stroke. 3. When should you get checked? If you're aged 40 to 74, the NHS recommends checking every 5 years. Over 75? Every year. But if heart disease runs in your family or you're experiencing chest pain, don't wait. Ask your doctor to test you. 4. What do cholesterol tests measure? There's more to the story than just a single cholesterol number. Ideally, your test should give you a full lipid profile. HDL, good cholesterol. LDL, bad cholesterol. Triglycerides, another blood fat. A good HDL level is above 1 millimole per liter for men. Above 1.2 millimoles per liter for women. LDL is healthiest under 3 millimoles per liter. A healthy cholesterol ratio, total divided by HDL, should be below 6, lower is better. 5. Don't forget triglycerides. These are basically unused calories stored as fat in your blood. High triglycerides equals higher heart risk, even if your cholesterol looks fine. The safe range: under 2.3 millimoles per liter, non-fasting. Under 1.7 millimoles per liter, fasting test. 6. Is cholesterol genetic? Yup. Even if you eat clean and hit the gym, your genes might fight back. Some people inherit familial hypercholesterol, which causes extremely high LDL regardless of diet. It affects about 1 in 250 people. If early heart disease runs in your family, get checked, even if you feel healthy. 7. Other risk factors matter too. Doctors look at your full picture: age, weight, blood pressure, lifestyle, smoking, ethnicity, and gender, to assess your heart risk. If your overall risk is over 10%, you'll likely be offered statins. 8. Statins, not the enemy. Statins are widely prescribed and very safe. They lower LDL levels by around 50% and help stabilize artery walls to prevent dangerous blockages. If that's not enough, newer options like PCSK9 inhibitors are available, especially after a heart attack or if statins alone aren't working. 9. Can you try lifestyle changes first? Yes. If your high cholesterol isn't genetic, most doctors are happy for you to try changing your diet and habits first, then retest in a few months. 10. What should you eat? Good foods for cholesterol control. Oats, beans, lentils rich in soluble fiber like beta-glucans, which block cholesterol absorption. Nuts and seeds, unsalted. Healthy fats: olive oil, avocados, oily fish, linseed. Fruits and vegetables, aim for 5 portions daily. These all support liver function and boost LDL clearing receptors. 11. What should you avoid? Bad for your cholesterol. Saturated fats, butter, cream, processed meats. Coconut and palm oil, yes, even trendy health boils. Ultra-processed foods. Sugary, low-fat products, which often sneak sugar back in. The golden rule: replace saturated fats with unsaturated fats whenever possible. 12. What about eggs? Here's the truth: the cholesterol in eggs and shellfish has little impact on your blood levels for most people. Unless you have a genetic disorder like familial hypercholesterol, eggs can be part of a heart-healthy diet. The real culprit? Saturated fats, not dietary cholesterol. Final thought. Cholesterol isn't just about avoiding eggs or popping pills. It's about knowing your numbers, understanding the risks, and making choices, big and small, that keep your heart healthy for the long run. So go ahead, book that blood test, swap the butter, and sprinkle some oats on your morning bowl. Your arteries will thank you.